welcome. We have some people joining us from Alabama today, so that's a wonderful addition to the class. Today we're going to start out with prevention principle overviews. And prevention is one of those skills that we love to learn about in theory, but as a practicing clinician, if you are working in intervention, prevention is less of something that's going to take up your day-to-day activities. The nice thing is, if your agency gets a grant, it makes you more mobile. By the same token, prevention, secondary and tertiary prevention can be used with a variety of other things during the substance abuse and co-occurring disorders treatment process. Today we're going to define risk and protective factors, which is actually one of my favorite things to do. Explore individual, family, school, and community risk and protective factors. Discuss ways to mitigate factors and enhance protective factors within the above four areas. Now, when you think about what we talked about with tip 35, you have the reasons to change, the reasons against change, the reasons for staying the same, the reasons against staying the same. So it's flip sides of the same coin. Same thing is true here. You have your risk factors that you want to mitigate, but you also want to enhance the protective factors. Identify specific interventions that can be used with families to increase resilience. We know that the family unit is one of those that tends to be the most problematic, but it can also be the most helpful as far as prevention goes. So identifying family interventions is going to be really important. The other issue with family interventions is if you're working with a child or even an adult, at a certain point they get tired of coming to therapy. So we need to know that the entire family has started to move along in the continuum. So prevention principle 1, prevention programs should enhance protective factors and reverse or reduce risk factors. We don't want to just take away risk factors because that leaves a void. Just like punishing a behavior, if all you do is eliminate behaviors, then ultimately you have an organism that has nothing in its repertoire with which to react. So prevention programs want to enhance those protective factors. And we'll talk about a lot of programs, including mentoring and those sorts of things. The risk of becoming a drug abuser involves the relationship among risk and protective factors. Most people that we work with are going to have some risk factors and some protective factors. Most people that exist will also have some risk and protective factors, but not all of them become addicts. Not all of them become criminals. Not all of them become clinically depressed. So the question is, what is the relationship? When we do a regression analysis, are there any factors that really jump out? The potential impact of specific risk and protective factors changes with age, gender, environment, and individual characteristics. Again, we'll talk about these more in depth once we get to the risk factors. It's important to remember that what is a risk factor for a 14-year-old is not going to be a risk factor for a 41-year-old. Early intervention has a greater impact by preventing future issues. Now, when we look at the Gillette curve, we can see that as the disease progresses, as the problems progress, everything around the person also starts to crumble. So if we can intervene early, then we have less foundational work to redo, if you will. Prevention principle 2. Prevention programs should address all forms of drug abuse, violence, and mental health issues, including underage use of legal drugs and abuse of prescription drugs. We've seen the increase in utilization of prescription drugs, kids going into their parents' medicine cabinet, abusing those drugs. Well, they're legal. Technically, it's not legal if they're not prescribed to you, but they are legally sold medications. We also have some kids who, for one reason or another, they play football, they do something where they get an injury, and they're prescribed pain pills. And they discover they like pain pills. So it may even be their medications that they're getting prescribed for them, they're legally prescribed, and they're becoming addicted to them. Thankfully, I haven't seen so far too many of those where a physician is regularly re-upping a prescription for an opiate for a teenager. It can happen, and I'm sure it does happen somewhere. I've just been blessed to not see it. Use of illegal drugs, well, duh. And mental health issues. Since we know that the expectation is that if someone has a substance problem, they'll have a mental health issue and vice versa. If we don't educate about the prevention of mental health issues, we're setting people up for that huge risk factor. We're setting people up to need to escape, to want to do something to make the pain stop. Prevention programs should address the type of drug abuse problem in the local community, target modifiable risk factors, and strengthen identified protective factors. I think there's like 8 prevention principles, so we'll get through those, then we'll get to the fun stuff. Programs should be tailored to address risks specific to population or audience, including characteristics such as age, gender, and ethnicity. So what we would do for a prevention program for college students is going to be very different than what we would do for high school students or middle schoolers, or even to a certain extent adults, because each age group has their own interests, has their own risk factors, has their own barriers, obstacles, and assets. How do you think a program would be different for, let's just keep 2 pretty similar, high schoolers versus people in college?
People in college got a lot more personal freedoms and flexibility to go and do what they want, so I'm sure you would want to recognize the strengths and the risks associated with that.
Sure. Okay.
High schoolers, I think you would want to target a lot more family kinds of things because they're going to be living with their families.
Right. So a lot of the stressors for high schoolers may come from that family unit and that family of origin, and they're kind of stuck. Most 16, 17, 18-year-olds are not going to up and leave and move out. They don't have the financial ability, the emotional ability, the cognitive ability. So we have to focus on that family of origin. Now, when they move to college, they may be lucky enough to get away from the family of origin if that is one of their risk factors. But then they're exposed to a whole group of people who, in large part, are still trying to figure out who they are. They're still trying to find their identity, which means they're experimenting. And experimentation gone awry leads us down a really bad path. I had probably a dozen or so students who lived in the dormitory where I was a resident assistant end up, over the course of their freshman year, flunking out. They just couldn't not party. They couldn't not go out. And these weren't even, actually the Greek system at our university was beneficial because if you didn't maintain a certain GPA, you'd be kicked out of pledge class. So the Greek system did have its assets as well as its foibles, but that was one way that they helped try to enhance the protective factors. The other thing with our Greek system was you needed to spend a certain number of hours at the house every week studying in the study room, etc., especially if your GPA was below a 3.5 on a 4.0 scale. You had to spend 7 to 10 hours in the study room every week. And if your GPA was above a 3.5, I don't remember how many it was. It was negligible. I could usually knock those out in one day. I think it was like 4 hours or something. In high school, it's sometimes a little bit harder because unless the parental units are enforcing boundaries and limitations and checking homework and making sure that Johnny is coming home and actually opening a book. And I will be honest, I was the worst student. Especially in high school, I would be doing my homework for third period on the bus to school in the morning. I would come home, drop my books at the door, and would not open them again until the next morning. So that accountability, I was lucky enough that I was able to really not have to study that hard in high school. But then when I got to college, it was a horse of a different color. So I did have to learn discipline. And at that point, I had to teach myself. So these are the things we need to look at. What sort of environment were the children, the youth, coming from when they went to college? And what sort of boundaries, structure, enhancements can we put in place in order to help them out a little bit more? Family-based prevention programs should enhance family bonding and relationships, including parenting skills. We want to look at the parents' supportiveness of children, and most of us can identify that we've been guilty at times of focusing too much on the no's. You know, if I'm going to say something, it's probably, hopefully, a constructive criticism, but a criticism, and taking the good things for granted. So encouraging parents to remember to say yes and say good job is really important. And when they say, well, he knows I'm proud of him. Well, how does he know you're proud of him? How do you show this? My kids in the educational program that they use online right now for math and language arts, it tells me how many hours they spend each day doing their lessons, how many lessons they do, how many practice problems that they go over, and then it sends me certificates. My 10-year-old, I got an email last night or the night before that she had spent 70 hours practicing math. And I'm like, woohoo, good for you. Because she really does not like computer-based stuff, but she likes writing it even less, so it's a toss-up. I think she just doesn't like doing the schoolwork. Parent-child communication, and that kind of is a nice segue into helping parents understand what is motivating or demotivating the child. With Haley, I look at her and I go, okay, what is it about doing book work or doing computer work that you don't like? Because she is, I'm biased because she's mine, but she's brilliant. I mean, she's always had a gift for numbers and been able to do math problems and come up with solutions to lots of different things. But I have to remember that her dyslexia makes it more challenging. So where I can pick up a book and whiz through it takes her 4 or 5 times longer than it would take another child her age, because she has to go slower and really focus on what she's doing. Communicating about that is important. Sean, on the other hand, avid reader, no dyslexia, but he's a perfectionist. And that had to be inborn because he has been a perfectionist since the time he could talk. When he gets things wrong, though, he takes it very, very hard. So communicating with him about realistic expectations. He took the achievement test at the end of last school year. He scored in the 80th percentile. He was devastated, absolutely devastated. When you look at the range, the majority of kids, it's not the bell curve that we think of for grading. When you look at the range on the achievement tests, 50% is passing and average and everybody's happy. 80% is exceptional. And he couldn't hear that. All he could focus on was the mistakes that he made. So increasing communication, so children learn to focus on the positive, learn to give themselves credit, learn to take a realistic view of things. By the same token, especially with younger children, knowing that they have a dichotomous view of things and they are very egocentric, we need to make sure that we are encouraging them to set their emotional boundaries, encouraging them to understand that, well, I may be having a bad day, I may be upset, I may be angry, I may just be grumpy. It has nothing to do with you. and encouraging them to identify how they feel on different days as well, and understanding it's okay if I'm happy, if I'm having a great day and you're having a poochy day, that's okay. You don't have to change to make people happy. We need to help them practice in developing, discussing, and enforcing family policies on substance use, violence, appropriate communication. When this white paper was written that this presentation was based on, was before bullying really came to the forefront of at least American culture. So communication skills and being nice sort of went without saying. Now we have to talk about online etiquette, face-to-face etiquette. I was watching at the gym, I was watching The View the other day, and they were talking about how kids don't say please and thank you anymore. How it's just get me this, I expect this, I'm entitled to this. Part of communication and being supportive and setting family boundaries is also encouraging proper communication and proper etiquette. We need to provide training and drug education to reinforce what children are learning about drugs. When you talk to a parent and you ask them, what are bath salts? And they say something I put in the bath. You know you've got a problem. When you ask them what spice is, you know, I can go on, and they say something you put in your food. You start to understand that there is a much greater problem. I don't expect any of my staff, let alone any of the parents I work with, to know all the street names, all the trade names of the different things, like Skittles. You know, Skittles to me mean candy. But then again, I also know that it has other meanings. So helping parents understand that there may be code words, if you will, there may be slang terms, and they have to ask. I've been working in the substance abuse field since the mid-90s, and I still will have patients come in, and when I'm taking their drug history, they tell me something they took, and I'm like, what is that? Sorry, what is that? And I think they respect that to a certain extent, because I am not the all-knowing, all-powerful counselor who's going to make their life miserable. We also need to provide training and drug education so parents can open opportunities for family discussions. There was a shooting, I don't remember when it wasn't so long ago. A bodybuilder had taken bath salts. Okay, you saw or read about that. And ultimately, the corrections officer and the police officer got into a scuffle with him, and he got shot. Bath salts, he was psychotic. He was actively delusional, having issues focusing. That can be a discussion. This man, who's a bodybuilder, ostensibly takes good care of himself. You can compare him to football players or whatever. So what do you think was going through his head when he was putting that kind of toxin into his body? Exactly. It also opens opportunities that, you know, maybe, I know spice, since it comes in such varying qualities. Some people smoke it and have no problem. Some people smoke it and they go into an aggressive psychotic episode that can last 7 days or more. And marijuana doesn't last that long. So 7 days or more. Talking with our kids about, you know, what would happen. It only takes one bad dose to cause you a whole lot of hurt. Parental monitoring and supervision skills can be enhanced with training on rule setting. Because I said so has never been followed. I don't think in my life, well, that's not true. I was afraid of my mother, so If she said, because I said so, I did it. But if we can teach them rule setting and how to explain in a constructive fashion why this is important. And sometimes it's just important because it's not appropriate for someone your age to be doing. Or you don't need to get into all the clinical, developmental, your brain can't handle the stimulus, yada, yada, yada. It's not appropriate. Techniques for monitoring activities. These days, with people having cell phones that have GPS tracking and you can monitor where they're at, it's fabulous. I remember back when we were growing up, you had the telephone, and you would call your mom or your dad and say, I'm at Jimmy's, and then if you happen to leave and go over to somebody else's at a party, or nobody knew where you were. Now we can monitor. It's still important to have children tell us where they're going, when they're going to be home, and hold them accountable to those things. If you're not going to be home by 6 o'clock, you need to call or text. Or there's no excuse for not getting in touch now. There has to be some way, even if it's only for a few seconds, at least for children. Techniques, praise for appropriate behavior. And we talked about this earlier. So many parents, if they're going to say something, it's because their attention was garnered because they got called into school for Jimmy's bad behavior. Any praise or any attention is better than no attention. If we can help parents see that praising positive behavior encourages their desire, and sometimes it has to be more than verbal praise. Sometimes the relationship is damaged enough that there need to be rewards set up. Is it bribery? Not really. It's moving towards something. It's earning something. As long as you're not promising a car or something. But moderate, consistent discipline that enforces defined family rules. In our culture, discipline has just nobody knows how to discipline anymore. You put somebody in timeout, well, they won't stay in timeout. So what do? Do you remember when Nanny 911 was on? I watched that a couple of times when I was in my child psychology class. And it was interesting to watch how she would basically wear them down. The child would get out of timeout, she'd put them back in. Get out of timeout, she'd put them back in. And eventually they learned that there was no winning this battle. And too many of our parents give up, and they've got a lot going on. I don't hold that against them, but they do need to realize that every time they give up, you've just raised the bar higher, because Johnny's probably going to go at least that far next time, if not farther. Maybe. There we go. Prevention programs can be designed to intervene as early as preschool to address risk factors for drug abuse, such as aggressive behavior, poor social skills, and academic difficulties. I think I've talked about my son's first preschool teacher before. I always said I wanted to grow up to be just like her because she was made to be a mommy and a preschool teacher. She was just amazing with the children. And I remember watching her in class sometimes because I'd be in volunteering, and she would have kids that were biting, acting out, hitting, throwing things, preschool. And she had the ability to communicate with them. Number one, she always got down on her knees, so she wasn't looming over them. But she had that ability. She'd say, how would you feel if Johnny did that to you? Or how do you think Johnny felt? Trying to get the dialogue opened in the child's head about empathy. Helping, and she would also redirect their behavior. If they were too wound up to have this conversation, she would provide them something appropriate to do. Taking a child who is throwing an absolute fit and saying, you've got to go stand in the corner and be still in a timeout, probably not going to go very well, especially if you've got children with ADD, impulse control issues, problems at home that are raising their anxiety levels. She had a little corner in her room where kids would go if they just needed to chill out for a few minutes. Not necessarily bad, it was just the chill out corner. And they could go in and they could walk around in circles, they could sit on the beanbag, they could do a variety of different things, but there were no toys. There were no other people, there was no attention given to them. Once they had de-escalated a little bit, then she would pull them out and have a discussion. None of them were bad enough. I mean, this was just a regular old preschool. It wasn't a behavioral special needs preschool. So none of the children were bad enough where she had to go into the chill out corner and talk to them and help them self-soothe because of self-injury. Most of the children won't get to that point if they start to learn how to manage their anger and their fear early on. And early on meaning preschool. How to share, how to communicate assertively. Poor social skills. How do you communicate? How do children talk to one another? How do they play? What is nice behavior? When my children are going to need so much therapy if they ever watch these, but when my son was growing up, and to a certain extent my daughter, but she learned by watching him. When he was little and we would go to restaurants and the waitress would ask him a question or give him food, he was always to say please and thank you. And if he didn't say thank you, I'm kicking him under the table. I'm like, what are you supposed to say? Not hard, but just enough. He's like, oh, thank you. It's amazing how much, once kids learn how to make eye contact and communicate appropriately, doors start to open. And they feel less frustrated because they can communicate what's going on with them. And then academic difficulties. Our society is built so much on success, on grades, on promotion, that if children are struggling in school, they're going to try to take the focus off that. Well, I can't do this, so maybe I will be a comedian. Maybe I'll be a troublemaker. Maybe I'll do anything to keep the fact that I can't do this hidden. All it is a distraction technique in many cases. And it's also the manifestation of the frustration. If somebody keeps telling you, for example, me, to do calculus, at a certain point, I'm probably going to start banging my head into the book, just hoping that I'll get it through osmosis or something, because I don't get it. So the academic difficulties are things that really set the tone for self-esteem in early childhood and will set the tone for how the child relates and what their self-efficacy levels are later in life. Prevention programs for children should target improving academic and social-emotional learning. The social-emotional is the empathy and all the warm, touchy-feely stuff. It needs to address risk factors for drug abuse, such as early aggression, academic failure, and school dropout, and should focus on self-control, emotional awareness, communication, problem solving, and academic support. Interestingly, they say in this particular paper, especially in reading. My thoughts on that are that so much of our society revolves around reading. You have to read instructions on the back of boxes to learn how to make macaroni and cheese. You have to read warning labels. You have to read and write on job applications. There's a significant portion of our world that revolves around reading. There is a big portion that revolves around math and science and those other things, but if you can't read, then you're going to have a hard time reading the instructions for how to do the math problem. Encouraging children to read is also another thing that, as a society, I think we've largely gotten away from, unfortunately, because there's video games and Wii's and all that kind of stuff. I feel so old when I teach this class. back when we were younger, in the olden days, we'd go outside. You know, I twirled baton for 4 years when I was in middle school. We would go outside. We would chase butterflies. We would catch fireflies. We would read books. I read the whole Nancy Drew series one summer. Because I loved to read, there wasn't anything else to do. We had, 4 channels? You know, think back to 1985. We had 4 channels, and there usually wasn't much on except for soap operas during the day. Now, there's constant stimulation everywhere. And you don't necessarily have to read. You can watch videos and play video games all day long. Encouraging that is really important because most kids really discover their imagination when they're reading. That's the other thing my mother always got hung up on, was how automated all the toys were anymore. They don't have, you know, they don't use sticks for, well, you're not allowed to have toy guns anymore, but, and I had to laugh the other day. My daughter went to Fiddler's Grove, that was what it's called, and she came back and she was so excited about this little corn doll that she had gotten. It was made out of a corn cob, and then the dress was made out of the sheath from the corn. She was so excited. And that was a doll like Granny used to have. Using your imagination also helps you figure out the problem-solving skills. You don't get stuck in that box of there's only one way to do it. Emotional awareness, we don't teach. Kids are just told to, you know, deal with it, suck it up, be quiet, you'll be okay. When I listen to parents dealing with their children who are upset, 90% of the time, what I hear is dismissive. You're going to be okay, you'll be fine, you'll get over it, not tell me about it, or help me understand why you're feeling angry. Helping them put a label on it. Kids aren't born with the vocabulary to identify all those emotions that we talk about. Which leads us to self-control. You can't label something that you don't even know what to do with. You're like, I don't know what this is. I just feel icky. Well, I don't know how to control icky. I know how to control anger, fear, sadness. From an early age, children need to learn those self-control skills where when they get angry, they don't want to go bite somebody or put their fist through a wall or, you know, whatever it is that they do. So how do they self-soothe? How do they deal with the adrenaline? How do they deal with that fight or flight reaction? And de-escalate. Like a broken record. I think DBT skills in early childhood are fabulous. You can be angry. I probably told this story before. We were at the office one day. My son was talking. He was verbal. So he was probably 24 months. He started talking a little bit late. And we were walking down the hall. We were coming out of the mother-baby unit, and I had to go to a staff meeting. His babysitter must have called in sick or something that day because I didn't usually bring him to the office. And he's walking out of the mother-baby unit next to me. And all of a sudden he stops and he looks at me and goes, "Mommy, I'm so angry." Okay. Anger was one he had a good label on. When he gets frustrated. He has a very low frustration tolerance. And I was able to stop and say, okay, I hear that you're angry. Let's talk about what made you angry. I mean, we're just leaving the baby unit. And he wasn't sure. He just knew he was angry. So we had to work at being able to feel the emotion and just let it go. So I was like, okay, so what do you want to do? And he wasn't really sure. So we went outside before my staff meeting, and I let him run around out in the park for a few minutes. And that took care of it. He had some pent-up energy. And at that point, he may not have been angry. He may have been nervous because, you know, it was either infants or adults. There was no in-between there, so he was kind of out of his element. bored. But once he got that nervous energy out, it was a dream. What is it that each person should have at least 3 things that they can do to enable them to feel a feeling without having to act on it? Combat breathing, running, meditating, whatever it is they do. My activities tend to be much more active. I clean. I go outside and trim the hedges. Combat breathing I can do if I can't get out to do something like that, like if I'm in a staff meeting. I want children to have these by the time they leave elementary school. 3 things they can do. Now, it may evolve over the course of time, but if they can start to handle stress and let things go when they're in elementary school, think about how much better life is going to be for them when they get to high school and people are being snarky and they can just let it roll off their back. Prevention programs for adolescents should increase academic and social competence with the following skills: study habits and academic support. Sometimes I get a mental block when I'm preparing for class, and I remember something that my committee chair told me when I was working on my dissertation. So I reached a point where I just had a mental block, and there was so much literature and so much stuff to go through. And I wish I would have known this in high school, because I might have opened my book. He said, do 15. Get on your computer, do whatever it is you have to do for 15 minutes. And after 15 minutes, if you're still checking the clock every minute and just completely miserable, do something else, because you're not being productive. For me, 99% of the time, for some people it may be a little less, once I start doing something, I'm good. So we have the do 15 rule at our house. Sometimes if my kids are going through a growth spurt, it'll be hard for them to concentrate. And they're like, I don't wanna, or I can't focus. So I said, do 15, try it for 15 minutes, and if you're still making careless mistakes, having difficulties, take a break for 30 minutes, and then let's come back and re-examine what's going on. Knowing how to get academic support. I was so proud last night. Haley announced to us, we have 2 orphan kittens, and we're guessing about 3 weeks old. And she announced to me that Indiana, it's Indiana and Jones, but Indiana is about ready to be weaned. Okay? Well, you try to wean them a little bit earlier, because the bottle feeding just is exhausting. But yeah, I thought 3 weeks was a little early, and I said, where did you come up with that? She said, I went onto the internet, and I read some pages on cat rescue and how to hand rear orphan kittens. And it said that when they're at stage 2, they'll eat food off your finger. And stage 3 is when they're completely weaned and they can eat food off the saucer. And she's already eating food off my finger and sometimes off the saucer. So I think Indiana's ready to be weaned. Now Jones, on the other hand, is a different story. Her words. I was like, oh my. I've created a little mini-me. But she came up with that on her own, and especially considering how much she hates to read, I was over the moon that she was resourceful and cared enough about the kittens to try to learn something without just running to me going, what do I do? Communication. How do you do it? What's appropriate communication? What's assertiveness? Yada, yada. We've kind of beat this horse, so we're going to move on. Peer relationships. Helping people define what is a friend? What do you need in a friend? What is loyalty? What is trust? In high school, being popular, I assume, is still like one of the most important things. But a lot of those peer relationships are superficial at best. Learning how to separate the wheat from the chaff, sort of, if you will. Those people who are your friends with you as a means to an end, and those people who are your friend because you are the end. Encouraging them to learn how to nurture relationships. Texting, it's good, I guess, that's where we've gone, but we also need to have personal, face-to-face communication. Even if it's not in the same room, video chat once in a while, see another human being. Self-efficacy and assertiveness skills, they need a can-do attitude. Not that, remember, last week or the week before, we were talking about global, stable, internal generalizations. And we need to help them have specific, changeable interpretations of things that may be internal, may be external. I am not stupid. I made a mistake. I was trying to convert regular time to military time the other day, and instead of adding it to 12, I added it to 10. And I was just like, I knew when I looked at it the mistake I had made, but I had already sent off the email, and I'm like, oh, Lord. And so the person I sent it to was like, are you a monkey? I've been able to count since I was like 4. Am I stupid globally? No. Was I careless in that particular instance? Yeah. Thankfully, it didn't, have any long-term effects. It wasn't like I was trying to schedule a wedding or something. But being specific is a lot, for the majority of things, is a lot healthier than global. I am a good person. That's a good global interpretation. We'll keep that one. Mistakes, things that happen, and even strengths that we have. I am good at certain things. I am not good at other things. So knowing that the specific things that I can excel at and where my weaknesses are, because that's where I find friends and stuff to take up the slack for the things I'm not as good at. That's what's important. Drug resistance skills, say no to drugs. I think more than saying no, for a lot of our youth, is to understand what their end is. When you're if you decide to experiment with drugs, what is the end that you have in mind? Are you trying to escape? Are you trying to fit in? Are you just curious? What is your end goal here? And what are the possible consequences? Let's at least make an informed decision if you're going to try. Because as soon as we tell them you can't do it, they're going to do it. Encourage them to make good choices. Violence resistance, gang resistance, this is all the same thing. We want to look at what is your motivation for this behavior? And what are the potential positive and negative consequences of engaging in this behavior? And then ultimately, they've got to make the decision for themselves. Reinforcement of anti-drug attitudes and strengthening personal commitments against drug abuse. If you have youth who want to go into the military, if you have youth who want to become lawyers or doctors, they really need to not be using drugs. I'm trying to remember. I think I could be wrong, but I'm thinking one of my friends who is a neuropsychologist, he had always wanted to go into neurosurgery, but since he had experimented with LSD and PCP, he was not able to do that. He still has periodic flashes from that, and it's been something like 30 years. What are the long-term consequences? And even drinking and driving. If you want to be a cop, if you want to carry a gun, if you want to do this, if you drink and then you get in a car and commit vehicular homicide, that's probably going to kill your chances of becoming a road deputy. Principle 9, prevention programs aimed at general populations at key transition points can produce beneficial effects. One of the things we haven't talked about yet, we've been focusing on the youth. Substance abuse can start at any point in life. And we have a lot of empty nesters. That's a huge transition period. When the kids move out, when you retire, those are two big ones, that people have a lot of time to think. And sometimes it's difficult to handle. They don't know what they want to do now. They don't know how to take advantage of the opportunities. Or, worse than that, sometimes they're reflecting over all the things they haven't got done on their bucket list or where they should be by now. We want to make sure that there are programs for people at all developmental stages to help them deal with the natural stressors that come with that stage. If you're talking to somebody who's 20 to 40, a younger person, they may be dealing with issues surrounding having a new child in the house, financial issues, new careers, marriages. People who are 40 to 60 aren't going to necessarily be dealing with those same issues. They may have empty nest. Depending on their career, there may be retirement. A lot of times retirement doesn't come until after 60, so then you've got that. Helping people look at changes as opportunities at each one of these stages is going to be absolutely critical. Interventions do not single out risk populations, therefore reduce labeling and promote bonding to school and community. We don't want to say, go into and I'm going to label, a community that is government funded, we called it Section 8, I don't know if that's what you call it here, housing, and say, well, this is a bad neighborhood, so we need to provide these interventions here. Let's not single them out. We were driving to a restaurant, and we have to go through the poorer area of town to get over there. And we go by a Section 8 neighborhood. And it makes me happy here. It's not the same everywhere. But at this particular neighborhood that we go by, these people don't have much money. But they're out playing in the yard with their children. They're engaged. They are trying to do the next right thing as opposed to sitting on the porch smoking weed and, little Johnny's running around with 5-pound Pampers on. That's what it was like in Florida. If we can provide some of these prevention programs at neutral locations like libraries, hospitals, community centers, and make sure that they're more generalized, it helps people not feel as isolated. We want to encourage bonding to the school and the community. School bonding, athletics, showing your team spirit, clubs. The school I went to, Wednesdays, we had shorter class periods. Every class period was shortened by 15 minutes. And in the middle of the day, we would have club. That eliminated the barrier for kids who couldn't stay after school because they had to ride the bus. It eliminated the barrier for them, so they were able to participate in some sort of academic club throughout the year. And if people chose not to participate, they could go to study hall. But clubs promote bonding, if it's chess club or science club, Spanish club, as well as sports. Team spirit is important, but not everybody's going to be an athlete. So we want to make sure there's lots of different opportunities. Bonding to the community. What is it that makes your community great? One of the things we'll talk about when we get to risk and protective factors is transience. When people don't stay in any one place for very long, they don't form friendships, they don't form patterns, they don't form habits, and they don't form bonds. Without a bond, there's not an attachment. Without an attachment, then why do I care? Examples that we might provide that are generalized, non-targeting, include stress management. Who couldn't use a little stress management tune-up once in a while? Time management, relationship and communication skills. If these are put on at, maybe it's even at your local wellness center, gym, like I said, library, that's one of those free places that you can usually get a room at, or churches. Now, some people will not go to churches if it's not their church because they feel sort of out of place. So churches have their own little issues associated with them, as do schools. If adults had bad experiences in high school and middle school, they may project those experiences and those feelings onto all schools and not want to go into a gymnasium or a library or whatever the case may be. They may not want to ever see the inside of a school again. Or if they had academic difficulties, going to a training in a school may reignite those feelings of inadequacy and lack of efficacy. All right, we'll go through this last one and then we'll take a break. Community prevention programs that combine 2 or more effective programs, such as family-based or school-based, can be more effective than a single program alone. Sort of like that old principle, if one person tells you something, If 2 people tell you something, you might really start listening. If 3 people say it, then you've got to look at what's going on. If they're hearing the same messages at home, at school, and on television, it's going to be more impactful than if it's just from one person or one source. Because people, I don't want to say children, adults are just as guilty, of seeing a single source as being biased. Well, of course you're going to say that, you're my mother. Well, no, not really. I am your mother, but I don't have to say you're brilliant. I say that because I think so. If they're hearing it at school, I remember when Sean was in public school, there was a reading contest to see who could read the most books and everything. And he got to be on the morning announcements, and oh, he was so proud. So he heard at school that reading's important. He heard at home that reading's important. He sees his father and I reading all the time. He sees that that's important. So it's kind of being reinforced on multiple levels. Okay, let's take a 5-minute break, stretch our legs, and then we will move on to